Hello, welcome to the Senior Spotlight. I'm Mary Cordova with Concierge Care Advisors, and this is Senior Spotlight number 17. We're going to talk about our advisory board today. Today, I am here with Dr. Brian Ferris and Linda Marzano and Shane Bray. And we actually are missing our doctor, Alex de Moraes, but he will actually be with us on the next spotlight. So, welcome, you guys. Thank you for coming to the spotlight tonight.
Thanks again.
Thanks for having us.
Absolutely. So, as you guys know, but not everyone else knows, we came up with an advisory board. This is something that Mark Lilly absolutely wanted to do from the time we invented this company 15 years ago. But both of our doctors absolutely have been wonderful to be have on this board. But to have now Linda and Shane, we're so grateful to have you and your backgrounds coming from all diverse backgrounds has been really helpful for us to look at our vision going forward for the next journey of people aging. So thank you so much again, Linda and Shane, our newest advisory board members. Really excited to have you here. So tonight we're going to talk about a little bit about your guys' backgrounds. And doctor, we all know about your background, but we'd love to hear it again. And of course, we'll share a little bit about Dr. de Moraes as well. So if we can start with our newest member, which will be Linda, and obviously ladies first. So we'll get into a little bit about your healthcare executive background, your advocacy for seniors and patients, and then we'll get into our other advisory boards as well. So welcome, Linda.
Thank you. Thank you for having me.
Of course.
I'm excited to be part of the team. I started my healthcare journey many years ago as a registered nurse, and I have always felt very strongly about patient care and have felt that being a nurse was more of a calling than just a job. And I had spent about 10 years doing clinical work and continued to progress in my career all the way through being the chief executive officer for a multi-specialty group practice and also the CEO of a capitated health plan for retired military. So I did a lot of work in DC around advocacy for retired military and their active duty family members. I also became the senior vice president of value-based care for the Providence Health System, looking at risk-based contracts and the care model needed to transition from a fee-for-service environment to more value-based care, which would bring more value to the patients and the providers.
Absolutely.
And improve outcomes and save money. And that's something I'm passionate about because everyone should have access to quality health care and be healthy and help be part of the community. And all of the healthcare organizations that we work with, whether it's public health or other supporting organizations or non-traditional partners in healthcare, I feel we all come together to bring quality care to patients in our communities that we serve.
So important. The quality of care, the good outcomes that the patients and their families can see. And I do believe that nurses have a calling as well, much more than a job. So thank you again for being on our board, and we're so lucky to have you.
Thank you.
Shane, we'll go back over to you and tell us a little bit about your background. I know you come a lot from the payer space, but would love to hear a little bit about your background and what you're doing on our board to bring value to not only the patients, but to their families and looking at their short and long-term goals on their finances, where they want to end up, all of those kind of things that we're creating. And you can share a little bit about that today as well.
Sure. So I guess similar to Linda, I started off as a nurse in the clinical field. Spent some time in med surg, ambulatory, emergency. Did that for about 14 years, and then made the transition from clinical to technology. Decided to make a bit of a career change. Went to engineering school, became a software engineer. Right out of engineering school, got started with a healthcare tech startup that went fantastically well. I won't bore everybody with the details there, but essentially it was really about creating a Medicare marketplace that brought in many of the Fortune 500 and 100 or so payers, many different plans, and it was really about helping seniors navigate the complexities of selecting health insurance products from Medicare Exchange, using an HRA mechanism as a way to pay for that. I spent about 14 years on that side, and then ended up in the payer space, somewhat really never thought I'd be in health insurance. Spent 5 years at Blue Cross Blue Shield, and have now transitioned out of the payer space and really focused more on healthcare tech, and spending a lot of time with Concierge Care Advisors, looking on what's next here.
So excited. I've learned something about you, Shane. I think a best kept secret that you're a nurse. I did not know that.
That's right.
So thank you for
Yeah,
sharing.
that's where I started.
So now I know your empathy and your passion and where it comes from.
That's right.
Thank you. Thank you for sharing. Dr. Brian Ferris,
Hi.
our leader, our vascular surgeon, would love to hear a little bit about your background and how you've been helping us as well.
Well, I'm delighted to be here, and we met, I think, about a year ago. I am a vascular surgeon, which when I trained, you became a general surgeon before you became a vascular surgeon, and I've been in practice, and I'd like to say that with a capital P, for over 20 years, because it wasn't just patient care, it was clinical research, it was participation in health networks, as well as hospital leadership. And over the last year, I've stepped out of clinical practice from my own wear and tear, and I'm doing more on the consulting and industry side, working with you all and other healthcare technology. I've got some experience in the device development world, but at the core, it's all about the patients, and that's what I really enjoy the most. And I learned a long time ago, and it's been reinforced through a lot of clinical practice, that patients do great when everything else is settled. And as a vascular surgeon, by definition, a large part of the practice is devoted to aging patients, senior patients. And so they're dealing with aging, Medicare, and everything else that comes from that. And what I learned long ago was when everything around them that was unsettled impacted their health outcome.
Absolutely.
And when it was settled, whether it was with family or family with assistance, and how to navigate that system, the outcome was vastly different. And we know that we're dealing with an aging population, we're dealing with increasing morbidities, and we've got a lot of amazing technology, but these basics are where we really have opportunity.
Absolutely.
And so it's fun to be here.
Well, thank you again. And we also want to highlight Dr. Alex de Moraes, who is not here today with us, but general practitioner and also specializes in concierge medicine and also on hospice. And I just want to say he has the best bedside manners of any doctor I've met. Not taking anything away from you, doctor.
Oh, no, I've learned from him too. And I know he'd love to be here, and yes, he can't make it. But his clinical expertise and insight into all these other matters, I think, is vital and
so helpful.
Very
on
helpful.
Our board, and again, he's still practicing. When he's sitting in here in the studio, his phone's blowing up constantly. He takes phone calls at any time. He's an amazing doctor. So I'm sorry he can't be here with us, but he'll definitely be at the next one. So I think from your backgrounds, it really shows that we're bringing together a vast perspective of healthcare policy, technology, and really collaborating. What does that look like in good, holistic patient care? And bringing in the families as well, as Mark always says, getting it right the first time. And making sure that we're depending on you guys to collaborate with all your experience to help us with good outcomes with patients, their families, the payers, home health, the long-term care arena, that can be so overwhelming for family members. As we all go through it on a daily basis, family members usually experience it once or twice. So it's really overwhelming. So again, thank you so much. As Mark Lilly would like me to say, he's emphasized the board is a changing game in the senior setting, a new standard for personalized, expert-driven guidance. And we're getting our expert-driven guidance from all of you guys, of course. So thank you again. I think what we would like to do is talk about the challenges that families face in just knowing which way to go. They have so many options out there, but the complexity of the options. Maybe they want to go to an independent living, and that independent living has already passed them by. They're in a walker. They may have some mental deficits. So maybe memory care is, down the road. So just really would like to talk about the medical concerns, the financial, navigating different levels, and how do people come about this and know, what direction to go. And as experts that you guys are from the multidisciplinary approach that you guys all have, we would like to just open the floor and talk a little bit about what you bring to the table to our advisory board to be able to help with good outcomes. If you wouldn't mind, Linda, I'll start with you. I'll go with Shane, and then I'll go to the doctor.
I started my career as a nurse's aide in a nursing home on the East Coast, and I always loved the passion and the care that the caregivers would give those patients. And I found myself just intrigued with the patients and how much I would learn from these patients that lived such a rich life, that they could talk to us about their experiences when things were going well for them, right? When they had their care, their medication, and their care was good. And I always appreciated that throughout my career. Even some sayings that some of them would say, I still remember. But I think it really hit home over the last 4 years for me personally when my mom became ill. And me and my 4 sisters were respecting her wishes to keep her at home. So I was flying back to the East Coast every 5 weeks, and I have another sister that's also in healthcare. And being in healthcare for 40 years and feeling so helpless and overwhelmed with what options we had and how challenging it was to get options and care for my mom in the way that we knew she wanted care or needed the care. And we were being nurses, but we were also being daughters. And I think that it's so challenging for the families. And we were both dumbfounded with being in the industry for so long, how little we knew.
And not know what to do.
And how challenging the resources were to get, even when we could speak their language of home health or hospice or with their providers. And I think trying to ease the burden of the family where we would stay awake at night just wondering, what do we do and where do we go next? And not having that support, where we felt torn because we really wanted to respect our mom's wishes. And I think something like concierge care can just bridge that gap, because it's hard enough caring for a family member when you're going through that emotionally and physically. But not knowing where to go for resources makes it even more challenging. So personally, I think that as many resources that we can give the family and the patient, the better, because we can't do enough for them.
And it sets them up for success to have all those resources.
Right.
And amen on the 4 sisters, because if we have people call us and they say, hey, I'm looking for my dad, we kind of want to say, do you have a wife? Do you have a granddaughter or a niece? Because women are a little bit better at navigating this than men, I will just have to say. But for all of you listening out there that don't know that there are senior advisors that can help with this and navigating this, it's a free service. And we help from, you may need 4 hours of in-home care at your house to remain safe, to moving somebody out of their home that's been there for 60 years. And I just want to bring up, because you and your sister are healthcare, it's so hard for people. And I think we all made promises to our parents maybe in 1983 when we were in high school, going, of course, Mom, of course, Dad, you never have to leave your home.
That's right.
We had no idea in 2025 it was $35,000 a month to keep somebody at home. So in retrospect, what I tell people is, even though you made that promise to your mom or your dad, do you think if they were of right mind, they would want to spend their resources at 35 grand a month to be able to stay home?
No, and I also think that if my mom, and she had a type of dementia as well, where she knew all of us, but she had no short-term memory. And she always thought, she would tell her friends, isn't it wonderful that my 5 daughters are here caring for us? But I was flying from the West Coast every 5 weeks. One of my sisters was flying from Florida, and we were all taking turns, sleeping on the couch, getting up with her to the bathroom. If she knew what that was like and how hard it was,
Right.
and I don't want this to sound cruel, but how hard it was to have to learn how to lie to her sometimes about certain things, I think she would have said absolutely not.
Absolutely.
Yeah.
You know, and I think it's okay to lie to people if it's not going to hurt them.
Right.
And I call them therapeutic lies.
Right.
And sometimes we need that with people with memory loss, because then they don't have to go through that pain again. Doctor, I can hear you want to say something about this.
Yeah, the gears are turning. It's one of the hardest points that we deal with, and some of the greatest lessons I've learned has been from nursing. And as I think of all those experiences and how I dealt or advised others, not only professionally but personally, is that, and again, not to sound cruel, but that loved one, that parent, that family member, their passing isn't a 0 and 1 affair. They're not here and gone. And I think we've lost that conversation. And I know I've brought this up on a prior podcast. There was a New York Times bestseller in the 90s written by a cardiac surgeon, and it was entitled How We Die. And he gave an address to my medical school, which was University of Virginia School of Medicine, shameless plug.
That's all right.
It is Mr. Jefferson's University, by the way. But it was very much focused on primary care and family medicine and the value systems that go with that. And I think we've lost sight with all the amazing developments that we have inside of healthcare and outside of healthcare. But we forgot some of these basics that when I think about these problems, I look at the big picture. What is the big data showing us? And I'm not sure we have all the answers. Shane, Linda probably could answer to this better than I. But I know most of us would like to be here and then not. And I think we forget that. And if we accept that, then that changes how the conversation goes. And I've always found that of value, again, whether it's personally or professionally, in terms of confronting those challenges of, if mom or dad or loved one only knew, of course they'd say, but the process is somewhat different, where we're going through the changes that we're all going to face because, we are mortal. And that somehow makes it a little bit easier. It takes the weight off everybody's shoulder. And I think it's also speaks across belief systems, cultures, religion, and so on and so forth.
Absolutely. And at another time, we'll talk about why failure to thrive does not have to be a part of that, but not today. I also want to not skip over what you said about caregivers, Linda. They're amazing. Later, I'm going to talk to Ashley Angst, one of our senior advisors, and we would not be able to do what we do with helping seniors move into housing or assisted livings or adult family homes or memory cares without all the wonderful caregivers. So definitely want to give a plug to caregivers, because our world would not rotate without them.
And it's also a reminder to care for one another.
Yeah. Yeah. Be caregivers for each other.
Mm-hmm.
Absolutely.
You have to be.
Yeah. Well, that's a big amen, and it's only Monday. So, Shane, I would love to talk to you about the landscape evolving rapidly. What trends are you seeing out there shaping the future of our industry?
Yeah, I think there's been a big focus in retail consumer goods, but now in healthcare about experience. Um, there's been a lot of effort put towards improving the experience of the patient experience and in the payer space, the member experience overall. And I think it's very, very difficult to improve experiences because those experiences are all built on monolithic problems of dealing with payers and dealing with complex hospital systems and dealing with PBMs. Um, and when I got into the healthcare tech side, I think I was a little bit naive about how we would be able to improve these things. So you start to see big corporations, has tried, Google has tried, Microsoft has tried, IBM has tried, Walmart has all tried to get into healthcare.
Mm-hmm.
And when they spend a few years in it, they look at it and go, well, this is way more complicated than we thought.
Right.
Let's let's go back to retail or technology or whatever it was we were doing before we thought we could do healthcare. And so I think that looking at how we improve experiences in healthcare is really starting to change because let's take my latest experiences at a payer. And when you look at what people talk about, they talk about complexities with claim denials, prior authorizations, and all of these things are based on such complex systems that it's very easy to get lost in the complexity. But I think where we can focus today is starting to look at the lack of data and I guess more specifically the lack of interoperable data that creates a lot of those problems that manifest themselves into customer experience issues when they're not really experience issues to be solved, but they're data and navigation issues to be solved. And that's why I think that looking at tools that provide data-driven decision support is so important, particularly in this space when you're dealing with mortality and when you're dealing with your aging parents. Families need to have access to clear, reliable information that's upfront so they can make confident choices. And I guess going kind of back to what Brian says, it's being sure you get the right decision the first time. And the goal is really to eliminate the guesswork and avoid the missteps that lead to disruptions, added cost, and really worst of all, poor outcomes for people in the most vulnerable demographic. But where the trend I think is heading is leveraging data, AI, to solve for problems that are decades, if not centuries old, when it comes to taking care of our seniors.
That's great. I think you're absolutely right. When we get people calling us, it's usually in crisis. Somebody from the hospital.
Sure.
My dad was a caregiver for mom. He is now broke his hip and fell. Mom's at home with dementia. We don't know what to do. And we have no idea of cost. And probably don't even have a power of attorney in place. All of those things that come along with all of this. As we have been talking about the Senior Navigator tool, I would like you to talk a little bit about that because you're talking a little bit about data, you're talking about outcomes, what is driving people to make decisions, whether they're good or bad decisions, because sometimes we have to let people, we give them all the information and they are still allowed to make bad decisions, right? But I think with that Navigator tool that you are working on behind the scenes with Concierge is really important to talk about. Kind of, it funnels you in buckets kind of where maybe you should be looking based on your demographics, your financials, your social goals, your mobility, all of those kind of things that come into the holistic person to make good outcomes. So can you share a little bit about that navigating tool that we'll be able to hopefully expose? And you can also talk a little bit about the focus group of seniors that we have looking at that as well.
Sure. Okay.
Thank you.
So we are working on a technology platform that will both be an app and a website. But when people think about technology, it's easy to think about applications and websites and and AI and all of these different digital interfaces. But the real power of tech isn't necessarily in the tools, but in the data that those tools can deliver. Families don't struggle because they lack access to technology. Technology is pretty ubiquitous. They struggle because they don't have access to the right information when they need it, and that's really what the focus of bringing the CCA Navigator app to life is. That's where digital transformations really start to make a difference. Instead of families guessing about care options and cost and quality, but bringing that clarity and confidence and really the experience that the Navigator technology and staff really bring. By making, I think, senior care more transparent and accessible, we can help families make the right decisions the first time. And I think that really changes everything. And as we're working through developing this app, as we're working to develop the front end technology or user interface, we're very much thinking about where people are in their lifetime journeys of is there cognitive impairment? Are there social issues? Are there religious things to think about? But thinking about all of those different things that we need that someone that is in that moment of need or moment of crisis is thinking about, that you don't necessarily think about when you're developing technology platforms, connecting the real human experience to it. So as we're working on these digital tools, we want to be sure we incorporate life experiences through not just our advisors, but those people that have worked with our advisors through user testing, and not really just, I guess, testing, but that user feedback of what's important, what terminology they expect to see, what expectations they bring in to the experiences that we're developing and delivering, but really doing it in an interactive and iterative way where we're delivering technology and data to the hands of people that they can have meaningful conversations with their families in a way that I think that they feel supported and less mystified by all of the different decisions that they need to make.
That's great. I think I'm really excited about that. And also the calculator that talks about long-term care, their social security, their income, what their house is worth. So it really puts them in a favorable place to be able to look at all of the options out there based on the finances that they have. So
yeah, there is a lot of data to think about. I mean, there's,
right.
as you mentioned, that's all the financial data. You got the financial, the geography, the family support. There's just so much that goes into it. And I think when we talk about complexity, it's easy to get lost on the technology aspects of it and all of the different things that make it complex. But it really, really is very, very complex to think about. Where are you going to get food? Are you going to see friends? Are you going to be able to make it to your church services? All of those things come into play when you're looking for senior care solutions.
Yeah, navigating. And as we know that app will not replace our wonderful advisors here, it'll just augment them and be able to give people a chance to be able to look well in advance to needing it, not calling us in crisis, but looking years in advance to even know what their planning looks like. So important. Doctor.
I'd like to add also, and I say this particularly with Linda and Shane here, is I think that for individuals who are going through this, I don't want to just say patients, right?
Yeah.
But and their families, is that they get this data, but then they also get better insight into how the system works. And I bet we can all four agree that a sizable part of the problem is they don't know how the system works.
Right.
So it's more adversity, it's higher stress, tension, it's less good for everybody. And I think, Shane, you touched on it in terms of the experience. You know, if somebody knows how to get around X, Y, or Z retail experience, whether it's Costco, Walmart, etc., they have a better experience. And I think understanding the complexities of everybody and everything that's involved in a health system or the insurance plan, and now they're starting to become more similar than different, is really important. And I think that data will help them understand where to look in the system for help.
Yes, I think it's going to set them up absolutely for success based on the data that we've already collected, for sure. Linda, you have such a great background, and to know about you jumping in to take care of your mom just warms my heart, I will tell you. So I would love to talk to you and get some feedback about, you know, what other people are facing, whether it is on the professional side or the daughter side. What advice would you like to give families out there that are going through this, that are still professional, still working, jumping on a plane because they made a commitment to their mom? You know, we also have to look out for your health as well, right? Caregiver stress.
Right.
That just doesn't go with a title of a caregiver, but daughters as well. What advice do you have to people?
I think just reaching out to your network and finding help, and finding organizations like Concierge Care to help you through it, to help you maneuver and navigate it all, because it is very overwhelming, even if you are in the industry. But if you haven't slept 3 nights in a row, you're not making good decisions, right?
Yeah, right.
And everything just seems so monumental. So really having almost like one person that you can lean into to say, I don't know if this is what you do or how you help me, but just help me, walk me through this to
That's
make
great.
it a little bit easier.
I
think we do need a resource, and reaching out to your network. You know, if your parent, loved one has friends and they want to help, be
Include
open to
'em.
have them, include them, because you do need that network. And, you know, trying to continue to work with your providers as well to bring care where it's most appropriate, instead of taking a 87-year-old patient in the car to go to the doctors. Use technology and how do we use it to bring care where it's most appropriate and most convenient for that patient.
Wonderful.
That loved
And, you
one.
know, a lot of adult family homes in Washington have home doctors, which has solved so many transportation problems and all of that. When we're talking to seniors and their family members, and we're talking to them about this, we're going to talk to you about financial, social, medical needs, geographical needs, spiritual needs, that holistic approach. There's so much that our advisors dive into to have good outcomes. And as Shane said, it's just so overwhelming, and there's so many pieces of the finances and people that might not have thought about things. Are there any properties that people own out there that we need to be aware of? Maybe they're looking to go on Medicaid down the road, and we need to know about that because the government always finds those kind of things. So it's good to know before.
But even helping the caregivers have that conversation with their loved one, because it's not always easy.
Yes.
So helping the caregivers, help guiding them with that conversation with their loved one, because sometimes they'll say, no, I'm fine. I've got my 5 daughters. I do not need this.
I don't need any help.
My finances are good. I don't need it. So helping the caregivers really have those, how do you frame that conversation in that situation?
And empower people to have those conversations. We often say, let us be the bad guy.
Right.
You know, let us come in and blame it on the doctors and say the doctor doesn't think you're safe. Right. It doesn't have to come from the daughter.
Right. And you're the experts in that situation, which is really helpful for family members to be able to lean into.
Absolutely. And whether it's our company or anyone else's company that comes to meet you and go out with you, hold your hand through the whole process, just make sure that you're not dealing with someone that gives you a list or a piece of paper to go look on your own. It's impossible for you to know all the questions to ask. So at Concierge Care Advisors, we hold your hand through the whole process. We meet you at bedside or at your house or at the nursing home, especially if you cannot go back to your own home, and then go share with you all the 3 options that are best fitted for you on the financial, social, medical, geographical side.
I think that experiential part is incredibly it's incredible value by CCA, because one of, I think, the toughest regrets is for a patient if I had only known. And I think you all help eliminate that.
Yeah. And I think starting those conversations, it's okay. I'm really challenging my whole staff to do at least 2 educational, get your ducks in a row. And we really talk about basically exactly what it says, get your ducks in a row. We have a financial person come in and talk to them, elder law, a real estate, and us, and talk about the holistic approach. And educating people so they can make good decisions to have good outcomes has been so fun. And Concierge Care Advisors is really good about giving back to our senior centers and our communities out there. So look for those as you are surfing the web and looking at senior centers out there. But we have a lot of get your ducks in a row at all the senior centers in the Pacific Northwest. Is there anything that advisory board would like to share?
I'd like to make a point on that. That is the difference between proactive and reactive problem handling. And that's really kind of one of the trends that we're working towards in healthcare, is being able to deal with things proactively. When you know what to expect and have some relatively decent expectations, problems are not as difficult to solve. They're easier to deal with, become a little bit less emotional. So being that proactive answer provider up front, explaining what expectations they should have about what's coming down the road. And an expectation can also be a bad expectation. As long as you're thinking about it, it really improves the experience. When you know that something is going to be terrible, but you still know, you have the tools to deal with it. But I think that's a real opportunity for us here too, is being more proactive than reactive. It's that reactive piece that is really, really difficult for people.
Absolutely. Oh, Shane, it's so funny that you bring that up, because I do most of the case management with my staff on all their patients, and they'll say, my mom, she escaped from the house, she went out, she didn't have clothes on, but we're going to go see a neurologist next week, so we want to wait. And I'm like, the outcome is still the same. You need help. They're going to tell you that, no matter what they're going to tell you, I'm not a doctor, but I know that you need help, and whatever they're going to tell you next week, that's not going to change, unfortunately. So I love that you say that, because I think sometimes just the experience and sharing with them that, we're going to prepare for this, but if this happens, we have this in our back pocket. So we're always looking for short-term, long-term goals, and making sure that we're looking at today, tomorrow, and forever. When we are out there working with our patients and seniors. And
that's a great segue to some of the predictive tools that you all are going to be talking about a little bit later. It's funny how that works out, because Shane's exactly right. I mean, in medicine,
that's right.
The more you can predict and set expectations, changes management of the entire, from the patient-centered experience of them knowing what's going on, again, always goes in your favor. Absolutely. As opposed to anything down that slippery slope towards reactivity.
Yeah,
so
good
there
outcomes.
You go.
Yeah, exactly. Thank you again. We cannot thank you from the bottom of my heart to be on this board. We are so grateful to have all 3 of you, and Dr. Alex that is not here with us today. But thank you again for coming to the spotlight, and we would love to have you again and highlight you guys. If you are listening online and want to get a hold of us, you can get a hold of Concierge Care Advisors at 855-444-7364 or www.conciergecareadvisors.com. Thank you.
Thanks.
Thank you.
Thanks, Mary.
Thanks, Shane.